Yeah, it's a battle for survival here in Ukraine for millions of people, Trace. So I think there are some eyebrows raised, certainly among Ukrainians here, when they hear Americans or Europeans talking about a couple of dollars increase in their gas. They say, we're fighting for our lives. That's a little bit different than paying more to get your car on the move. Anyway, a number of cities in Ukraine are facing heavy artillery shelling and missile strikes, leaving large numbers of people obviously in desperate need of medical supplies and help. But moving those supplies to where they will do the most good is a lot easier said than done. Joining us now is Dr. Refugee Fernando, a disaster and infectious disease doctor who is currently treating patients near the Poland-Ukraine border. Doctor, thank you so much for joining us. Thank you for the work you are doing. What is the biggest need for the patients you are seeing there, the refugees?
Yeah, thank you so much for having me, Jonathan. And this is an unbelievable humanitarian crisis. The first thing which should really happen is that, at the very least, a temporary ceasefire where countries are allowed to ship their things and their medical supplies are allowed to reach the people over here. The biggest problem also we're seeing is with these attacks. We've seen attacks on maternity hospitals, now on a cancer hospital. So it's also very important when the supplies come in, we have to have healthcare personnel to treat these people in decent facilities. Unbelievable shortage of goods. We're seeing, of course, people in battle. We're seeing basic shortages of tourniquets. Other medical ICUs don't have IV fluids. This is a big problem. The other thing that I also want to talk about is people don't talk about the fact that there are common medical problems like high blood pressure or cholesterol or diabetes. These supplies people are not able to get this. The other big concern I have, of course, is with COVID-19. There's a huge surge of COVID-19 cases in Ukraine, and only 33% of Ukrainians are vaccinated. The whole programs are all held, vaccinations for kids, polio. This is going to be a catastrophic problem, an unbelievable humanitarian crisis. So the only thing I can see.
So, Doctor, do you think it's going to get better or worse? Do you see that help is on the way? Are the supplies beginning to ramp up, or is this going to get a lot worse before it gets better?
Well, the problem is with supplies coming in. When they're going in from, for example, from Poland to Ukraine. We're assuming the trucks, when they are going into Ukraine, they're assuming a safe route. But nothing is safe. Everything, the whole situation is very dynamic. A green area may turn red. Missiles are coming from all over the place. So there's no safe route. Supplies, more and more supplies are coming in. The world is here to help. Everyone who wants to help Ukraine. But the routes are very dynamic and things can change any minute.
So, Doctor, you obviously are used to seeing patients in great distress, used to seeing terrible situations. But the amount of refugees flooding across that border, the conditions that they have had to endure to get there, how does it affect you personally, Doctor?
Well, it's a great question. And firstly, I've been honored to work with Doctors Without Borders in Darfur during the genocide time. And I've seen this before. I've also worked in Bangladesh with the Rohingya crisis. I'm happy to have that experience because coming into this situation, you have to have a little bit of that experience. But the one thing that I'm seeing over here, which is really changing things, is the sub-zero temperatures, Jonathan. It is so cold over here. Half the cases I'm seeing are frostbite. I mean, that is really changing the game over here. People coming in, they're walking all the time. Sometimes it takes up to 3 days to get across the border. So the sub-zero temperatures is something I'm learning to deal with as well.
Dr. Refugee Fernando, thank you for the work you are doing there. I know that every Ukrainian mother, every Ukrainian child that is seeing you and people like you is very grateful for the fact that you are there. Dr. Refugee Fernando, thank you very much from on the border between Ukraine and Poland. And Trace, it is always the case. We've talked about this before, Trace. You and I have both seen it up close. Amid the worst of human behavior, you see so much of the best of human behavior. Well, as well. People like the doctor coming in to do whatever they can to help. Trace?
But Dr. Fernando makes a very good point, Jonathan. We sometimes tend to forget, but we talk about necessities, meaning food and fuel and basic medicines, but he reminds us there are millions of people who rely on insulin and other medications to stay alive, and those have to get in there because people will die one way or the other if they don't. Jonathan, thank you. Back to you in moments. The fight for Kyiv heating up overnight with Russian forces picking up momentum as it moves toward Ukraine's capital city. Could the city fall into Russian hands? The Ukrainians say no. We'll have more on that coming up.